Dr. Alex Beaulieu is the Chief Medical Officer for United Healthcare's Medicaid business and Senior VP of Population Health and Social Care. He explains how certain social factors impact health. Good morning.
Good morning.
So explain to us what these social factors or social drivers are and exactly what we're talking about in this negative impact on community health.
Sure. Well, social drivers is just the technical term for those things that we rely on every day to keep healthy. Things like housing, transportation, quality food, but also education and employment. Those things have a big impact on our health, and perhaps that's not surprising. But what does sometimes surprise people is that those factors have a bigger impact on your health than access to your doctor or the health system.
And so explain why that happens.
Well, for a variety of reasons, people don't have access to those factors. Often it's low income, but sometimes it can also be, sort of suffering in silence. And we're trying to raise awareness about that today as we see that there's a lot of this need amongst our older Americans. And sometimes they're just not comfortable sharing that maybe they don't have enough to eat at home or that there are challenges with their housing.
So once these folks are identified, where can you send them to find resources to help improve their overall health?
Well, at United Healthcare, we start with the actual benefits that we offer first. We offer transportation for many members and sometimes food and over-the-counter drug benefit that can be applied to online grocery shopping. But in addition to our benefits, we also work to connect members back to resources in their own communities. That could be a local food bank, a local government program that helps weatherize homes, or any number of different groups that are trying to help.
So when the community gets involved, when the community is educated about these very real, sometimes silent problems, what are you urging leaders and game changers to do to help the folks in their own communities?
Well, I think you're raising a really important point, which is that this really does have to be taken to the community level. We can't just work at the individual level to meet somebody's needs. We have to recognize that those needs arose because there may be not enough opportunity in the community where somebody lives. So we work to partner with community-based organizations like those food pantries or other services for older adults, as well as local government, to come together and identify what are the needs that we need to address and how can we push resources into expanding that community's ability to meet those needs so that we're not just serving the individual, but we're really trying to get upstream before these needs develop in the first place.
It's just such a big topic and so important on every level socially. So can you send our viewers to a website where they can learn more?
Sure, yeah. People can go to unitedhealthgroup.com/research. There they can look at some of the study findings that we have from screening over 4.7 million of our Medicare Advantage beneficiaries, as well as find out information about your own state and how things look locally.
Thank you very much for all this important information.
Thank you.